And the therapy is the one place that you can say like whatever is in you, and hopefully your therapist will treat it with compassion.
Why does therapy so often suck for men?
So there are a couple of reasons for this. The first is that I think we have a misunderstanding. Somewhere along the way, we got the impression that talking about our emotions is the best way to handle them. So I think we have a bias about our understanding of emotions. We think, first of all, they're primarily mental. Secondly, we think that talking about them is the way to go. And therapy is the best evidence-based approach that we've got, basically historically, of dealing with your emotions. But I think there are a couple of biases. The first is that the majority of therapists are women, and the majority of patients are also women historically, which means that if you're looking at a population and you say talking about emotions really works for my patients, if you're just a therapist, we don't really segregate between our male patients and our and our female patients. We sort of like look at this and we say like, this is what works. Now, there are lots of trials that actually show the opposite of that. So we'll have trials on cognitive behavioral therapy that look at 50% men, 50% women. Both of them have good effect sizes. But there too, I think there's a selection bias. Because even if you're looking at success in therapy, you're not counting all the people who left.
That didn't go to therapy in the first place.
Because talking about emotions did not work for them. Yeah. There's even a really interesting paper. So there's a lot of exploration into this. And one paper actually points out that there are two kinds of therapy that you can give. One is what we call emotionally supportive therapy, where you talk about your emotions. And the second is something called instrumental support, which is like problem solving. And what we tend to find is that men prefer problem solving. But if you look at